This is a very important person because she is making sure that we deal with the issue that's actually leading us to have this as a virtual conference. Now, allow me to cross over to Dr. AGNES MAHOMVA. Now, she is the Chief Coordinator in the national response to COVID-19 in the Office of the President. Now, she presides over a very important arm of our health concerns today, and she's going to deliver our keynote address for the 11th edition of the This Now Virtual National Students Conference.
Good morning. Just waiting for a confirmation. Thank you very much. Thank you for that confirmation. And indeed, I'm extremely delighted to be part of this very historic conference. I am really honored. When the invitation came, I struggled because there's so many conflicting activities, meetings, and in fact, this presentation is going to be very short, but I'm still really delighted. I would like to congratulate the students and the youth working on a reproductive health action team, the Say What, for their resilience. They are pushing and making sure that this happens. I think it is so important. Many times we work with organizations, youth organizations, and we hear the organizations, individuals wanting to know what everybody else is doing for them, how they can be brought in. But this preparation clearly demonstrated to me that this youth group means business. They are taking action, they are moving, and they're leading. So I truly want to appreciate you and indeed really say thank you for inviting me. I am told that this the theme for this conference is safeguarding adolescents and youth sexual reproductive health rights in the era of emergencies. I thought, wow, yes, indeed, here we are. We have the COVID-19 pandemic emergency, a pandemic. Most will remember when it started, we thought, well, maybe it will end over there in China, but it became a pandemic. And we are looking and saying, what is it that we need to do as a nation? But I'm happy the youth have jumped in and say, what is it that needs to happen to be able to make sure that the youth are involved and so on. So this theme brings to the fore some of the concerns of the youth. We should not be overlooked. And again, I want to keep emphasizing should not be overlooked by the leadership, government, but indeed the youth itself should not ask for others to lead, but for you to continue leading and of course continue asking questions, but participating in a holistic fashion, taking the bull by the horns, if you like. So the reality that we see on the ground, and I'm delighted that government has always continued to think about youth, but of course the youth themselves need to continue pushing so that they are not forgotten. I'm delighted that government developed with Ministry, of course, led by Minister of Health and Childcare, basically saw it fit to make sure that the Zimbabwe's response in developing the adolescent and sexual health reproductive health strategy was reviewed and renamed the National Implementation Plan for Adolescent Health and so on. Certainly, this is a milestone. It really demonstrates that we're continuously as government looking and saying, what is it that needs to be done? How can we revisit, revise to ensure that the strategies that are in place are responsive to the current. This pandemic was declared by WHO, did not waste any time at all. Immediately put in place a preparedness and response plan, declare to actually put in a lockdown. And that lockdown allowed Zimbabwe to respond accordingly. And I'm happy that researchers have actually demonstrated that that was the best thing to do. We basically managed to buy time to put in place what we needed to put in place. His Excellency went on to actually also put in place a task force, which is made up of 8 subcommittees. And I'm saying this to make sure that it is very clear to the youth that your role in this response is so vital and important, and to try and articulate where you come in so that you continue jumping in and strengthening how, one, you're supporting the national response, but at the same time, that will also enable the national response to support your activities. So the task force has got 8 subcommittees that basically lead all the various various sectors in Zimbabwe, whether you're looking at the logistics committee, whether you're looking at the food and water sustainability, which talks of social welfare, whether you're looking at the health strategy and infrastructure, which is the core. And I know from this program, the youth, you can come in through that main subcommittee of the response, the health strategy and infrastructure, which really covers a number of pillars, and reproductive health is very much there if you're looking at what needs to happen and so on. So I'm really delighted that you're coming in and you're actually working with the government to try and make sure that you're part of this response. The COVID-19, as we implemented the strategy and the task force leading and coordinating the response, it became very clear that we were focusing a lot on COVID-19, the disease. While we did have all these other sectors coming in under the subcommittees and so on, the core still remained COVID-19, and hence a lot of things sort of left behind, if you like. And that's a big concern, which includes also the issues that touch on the sexual and reproductive health for the youth, the gender-based violence and so on, as people are chasing up the cases. How many have we identified in Harare, Bulawayo? How many have died? What is it that we need to do? Those other essential health services seem to have been lagging behind, but we took note and we're actually working on it. Most of you will know that Cabinet introduced an experts advisory committee, and I'm happy to say, as we're speaking now, this week, we've got a team led by Professor Kambarami out in the field, doing a survey that looks at those other essential health services, trying to find out how has COVID impacted on that, and that there is a youth component to that. So we're very happy that we're actually looking at that to make sure that information that comes out there is able to guide us and lead us to say, what is it that we need to do with the disruptions that everybody is saying actually came on because of COVID. We are aware they have happened, but the actual magnitude is not very clear, and hence this survey that the Experts Advisory Committee is doing. And I will be so delighted when they come back with the results to share with so that you're able to incorporate that in your own plans and move forward with one, supporting the national response, one, strengthening what is happening in that national response to support you, the youth, and what you actually need to do. It is really so important in the sense that our young people are gathered to find solutions regarding some of the challenges on their ability to assess sexual and reproductive health during COVID-19 pandemic. But it is so important that that participation, that activity has got to be guided by science. And this is why I'm emphasizing on this particular initiative that the Experts Advisory Committee is gathering the science that will help us, that will help you make sure we're moving together, and that the youth are actually one, supported, as I continue to say, but in addition, creating a platform for the youth to support the national response. It is so critical that we continue working together as a team and not in silos. We can indeed wish away COVID-19, but I'm telling you, it's not going anywhere. This disease is here to stay. Moving forward, it will probably, like another malaria, will have a season where it shoots up and it comes down. And as it is so critical for us all as a national response to really change our behaviors, embrace the new normal, make sure those preventative measures, the recommended orders that government has put in place are adhered to. So it cuts across the board, the youth, the what have you. We are so aware as we look at our statistics that the elderly, those other conditions, underlying conditions seems to be affected more, that the youth don't seem to be affected more. But it is important for the youth to realize that even if you get the disease and you don't really get very seriously ill, according to the statistics now, you become the ones who are spreading it. So how can you be responsible to participate in the response to ensure that you're also adhering to the new recommendations for the good of your grandmother, for the good of the elderly who are leading the country, but for you to in turn also make sure you're supporting and strengthening new strategies that help you in turn turn, what is it that you need to do not to get the infection? What is it that you need to do to make sure those other essential health services, sexual reproductive health services for the youth remain in place? They are servicing you, and that you are quite comfortable with that. I really would like to once again thank you for allowing me to give this very brief presentation, but to encourage you to congratulate you for really being so proactive, for really coming in, jumping in, not waiting for somebody to come and drag you to the table. You are at the table now. I just want to encourage you, please look out for the 8 subcommittees I talked about, the health strategy, the law and order, and so on. I am very much available to give additional information so that your participation is right at the highest level, and that we in turn are paying attention to the things that might have been dropped because we're focusing so much on COVID-19. As I conclude, I wish to you to really continue your deliberations, and I hope they'll be very fruitful. And I would like to say, during this year's conference on National Student Conference on Sexual Reproductive Health and Gender-Based Violence, please continue letting your voice be heard. I'm delighted you invited me. You are very proactive, and let's continue. Let's make sure that you are indeed making sure your proactiveness is bringing solutions where others choose the path of complaining and being hopeless and so on. You are really demonstrating leadership, and that's what we want from our youth. So rebuilding Zimbabwe is a collective responsibility. As I've said, it's not just government responding to COVID-19, it's you coming to the table, and you've done just that here. It's you pointing out those challenges and gaps that we sometimes don't implement because we just didn't see it coming. But if you bring it out, we are really able to work together. So once again, thank you for having me on this conference. I wish you really fruitful deliberations. Once again, I'm very available to continue supporting you. Let's support each other. And indeed, when you come to approach me, I might be very busy, but that should not dampen your spirit. I thank you.